everyone, we are here to talk about the fetal maternal hemorrhage screen today. And what we have here is an D negative mother, so RhD negative mother, and an RhD positive baby. The baby's information was obtained from a cord blood, whereas the mom obviously was venipuncture. So this is after delivery, and what we want to do is decide whether one dose of RhIg, which is anti-D antibody, should be given to the patient, the mom, in order to prevent alloimmunization against D antigen, so that any consequent pregnancies hopefully are not affected by her production of anti-D to the baby's red cells, fetal red cells that have the D antigen on them. So if this is a positive test, then we would go ahead and do a Kleihauer-Betke test, which is basically you're making a slide from an acid solution that will detect whether there is fetal hemoglobin present in red cells in the mother's circulation. And so we don't have that today. We're not going to be doing that today. Even if we do get a positive, we're just going to be doing the Rosette test, which is what the fetal maternal hemorrhage screen is. So what we're doing is we're going to be adding a modified anti-D reagent to the patient's blood in order to see if there are fetal cells running around in her circulation. And so once we do that, if those fetal cells are present with that D antigen, that modified anti-D reagent is going to bind to them. And then what we're going to end up doing is after that, we're going to put indicator cells in there in order to form a rosette around those fetal cells that are present in the mother's circulation that have D. Okay, and so the indicator cells are basically a weak suspension of donor cells that contain the D antigen, and we're going to do the positive and negative control treated the same way as the patient. So that means we'll add the modified anti-D to the positive and negative control, and then we'll wash them just like we will be doing with the patient cells, and then we'll add those indicator cells as well. Okay, so that's the main gist of what we're doing now. So as with everything else, you want to make sure that your reagents don't have any of the cells on the bottom because you've mixed them gently. I like to do that in the container they came in. All right, so if you look at these, we have so we have the modified anti-D reagent on the right there. We've got the indicator cells right next to them. And then on the other side, we have the positive and negative control cells. All right, so let's go ahead and get started. The patient, obviously, those cells are going to come from the red cell suspension. So I labeled my tubes already to be the patient, positive control, and negative control. This is like a micro negative where you do the equal sign with the slash through it. Okie dokie. So first we're going to take the modified reagent, anti-D, and we're going to, I mixed it, but so you can see, we're going to add 1 drop to each of the tubes. Remember, anytime that you are doing this, you should be running the QC right with it. All right, so the next thing I'm going to do is add a drop of my beautiful red cell suspension here into the patient's tube. Okay, just one drop. And now I'm going to add a drop of the positive control to the positive tube. So again, make sure you don't have cells down there. Gently resuspend. Okay, so positive control is in the middle. That's one drop. Now we're going to add negative cells. So obviously these would be cells that do not have the D antigen on them. All right, so what we're going to do, I'll leave that open. So now we're going to just make sure that these are getting to know each other a little bit. And we're going to let them sit in the rack at room temperature for 5 minutes so they get to know each other really well. All right, so clear. And we'll get back to you after those 5 minutes. All right, so our timer is about to go off, and we are going to take these 3 tubes and we're going to wash them with the cell washer. So I'm going to turn that off. Here we go. All right. Here we go. So I'm going to put one of them in one. And then 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 9. All right, so I put 8 spaces in between each of them since we have 24 spaces. So they're in 1, 9 on the red, and then 5 on the blue. I'm gonna close it. Start. All right, and we'll come back. All right, it's done. We're gonna open. There's mom. That was negative QC. And we have positive QC. Okay. So now we're going to add the indicator cells. So that the rosettes can be formed. So here we got the indicator cells. We're adding 1 drop to each tube. Now we're going to centrifuge them for 15 seconds, just like in between our different phases. Okay. I should be putting 3 in between. There we go. So we got 3 in between, so they are balanced through the rotor. All right, I'll get back to you. All right, so we're going to pull these out now. So the next thing we're going to do is we're going to make slides in order to check them out underneath low power. So we'll do 5 fields of low power, and if there are 5 or more agglutinates, then that is considered a positive Rosette test. If it's 4 or less in 5 fields, then that means it's a negative Rosette test. So positive, you need to do the Kleihauer-Betke afterwards in order to identify how many doses are needed of the RhIg in order to prevent alloimmunization of the patient for the next pregnancy of a possibly positive, D-positive fetus. And if it is negative, then you obviously don't need to have more than 1 dose. Okay, so, all right, so let's go ahead and get this started. So I have positive QC, mom, negative QC. So I'll put those in order that way. Positive QC, mom, negative QC. All right. I'm going to use a cover slip to make it so we're spreading those cells out. Let it go along the edge and gently drop. Go again, go along the edge, let it drop. So that should make it so that it's not extremely thick, and you should be able to see the cells spread out. So as we said, we are going to put it on low. That means 10x. So I'm going to set my microscope up to be able to see and hold my phone. So I'll get back to you. All right, so this is looking at the negative QC. Sorry, this is the positive QC under 10x. So this is 100x, and obviously I'm using a little magnification on my cell phone as well. So you can see the cells, they're very small. The pointer is in the middle, that's that dark thing, and that's on our microscopes. So we do have some clumping a little bit. But it doesn't look like we have those beautiful rosettes. There's a little clump of there that I just went away from. It looks like there's a little bit of roulette. Oh, this is what we're looking for. So I just put it at the tip of the pointer. So that's a rosette that we're looking for. So we want to see 5 or more of those per 5 high power fields for it to be a positive. Remember, this is the positive QC. So hopefully we'll be seeing some really good ones. So that is 1. And that's 1 low power field. Okay, so we've got a few more here. We've got, let me put it, there's one and kind of two. There's a second one that looks more rosette-ish. So there's 3 so far, 3 official ones on our field. Here is a 4th one. All right, and this is our 3rd high power field. And this is part of the 3rd. I'm just trying to put it at the pointer so you can see it. There's another one, so that's, I believe that was 4. And then there was another one that was in our, come on, right up here. That was in our line of sight before as well, which I had moved away from, and I'm sure you all were viewing and going, no, don't run away from that one. So we absolutely do have 5 or more per 5 low power fields. We have some clumping up here as well. So there's another rosette. I'm just trying to take a couple of pictures also. Okay, so this is a positive, and that matches. So the QC is good. Let's put on the negative QC. Obviously, the negative QC should not have those clumps. So we see good distribution here. This is the 1st field, 2nd field. That's crap on the slide. That's not part of, it might have been on the cover slip. This is the 3rd field. We'll go over. 4th field. 5th field. So this is good. There are no clumps here. So that's good. No rosettes. Let's go to the patient's slide. Oops. I'm just trying to get to the center of the slide here. Okay, so we're in focus now. Here's 1 field, 2 fields. I'll go over 3 fields. There's a little bit of a clump right there. Not that thing, that's trash, but if I were to go over like this, that's a little bit of a clump right there. And there's one over here. Oh my goodness. So we might call that 1 or 2. I'm kind of just going to stick with 1 right now. There's kind of one right there, down there. Okay, let's move. Sorry, go back over this way. So that was 1, 2, 3. This is 4th low power field. And 5th low power field. So this one, there were a couple, but that was considered negative. So when we have a negative result, we end up, oh, here's another one, but it wasn't in the 5 that we did. So we've seen 3 to 4. Let's try one more. Oh, there was one. Right there. So there are a few in here, but if we were doing 5 consecutive high power fields, then that would have been a negative. And so you can see that these are very few and far in between. So this person, most likely, that's a good one right there, does not have a positive, I mean, they're present, so absolutely you give them the RhIg. However, oh, there's a good one. Uh-oh. Okay, so we were just starting at a bad spot, apparently. This is showing a much larger hemorrhage. Okay, so I'll take that back now. We have we have a lot of, wow, we were just in a bad spot on the slide. Okay, so if we started now and did did our 5 power fields, we would already, even in 1 power field, be above. So I think it was just how the cover slip laid on there, but these are actually absolutely clumps. You can even see, you know, up here where they're clumping together, and it's not just like this mass that I'm pointing to right now. So yes, this would absolutely be a positive. So this patient would be a great candidate for more than 1 doses of RhIg immunoglobulin, which is, you know, anti-D. But the thing about that is, this is qualitative, okay, which is just saying, are we going to need, number 1, is there a fetal maternal hemorrhage? Okay, so meaning, did baby cells get into the mom's blood that are D positive? And is it a larger volume than what the dose of the Rh immunoglobulin would cover, which would be 30 milliliters of fetal whole blood? Okay, so this obviously looks like it's more than 30 milliliters. So we would do the Rosette test and count, quantitate. So that's a quantitative test. And then from there, you use different calculations in order to calculate how many doses of the Rh immunoglobulin to give the patient. All right, so that's the end of this video. Thank you so much for watching. If you liked what you saw, please feel free to subscribe and hit the notification button so that you'll be notified anytime a video comes out. You can customize your notifications to get just certain types of alarms, so feel free to look at those. Thank you so much for watching, and we'll catch you next time. Bye.